When kids are struggling, don't be afraid to ask for help. There are so many resources out there. There are professionals, therapists like myself, and also other resources out there for when you do need a little bit of extra support.
Due to the delay in students returning to school and remote learning beginning on January 10th, therapists are recommending ways that parents can prioritize their kids' mental health during remote learning. A new study from Sick Kids Hospital in Toronto say that during the COVID-19 pandemic, 70% of youth ages 6 to 18 have experienced one or more of these symptoms: depression, anxiety, irritability, lower attention spans, hyperactivity, and obsession/compulsions.
It's been a really hard time for kids. I've seen a lot of kids coming into my practice who are experiencing a lot of stress, a lot of fear and anxiety. There's so many changes going on, so much instability, and for kids in particular, we need stability, and kids need stability to understand what's going on in their world and their lives. And it's a really difficult time.
With the added stressor of online school, Leah says a lot of kids will find it challenging because they need in-person contact with their teachers and a school environment to keep them focused.
At home, a lot of kids find it hard to stay focused on a screen all day. They find it hard to stay focused when they have all these distractions of home around them. And so where parents come in for this, a lot of it is just really taking the time for their kids. Of course, it's always important for parents to take time for their kids and to spend that quality time with them. But especially now, when kids are likely deprived of other in-person interactions, they really need that attention from their parents.
While some kids struggle with remote learning, family therapist Scott Erickson says others find it enjoyable.
I've known lots of kids who think online learning is fantastic because they can hang around in their pajamas all day. I know lots of kids who think that it's awful because they don't see their friends. And so there's quite a variety. They like not having to get up as early. They like the fact that they can sometimes turn off their camera and be like, some of them are actually literally like on their phone, talking to their friends while they're in a meeting with their teacher.
Scott says kids do learn better in person, and their mental health is also better when they are in school and when they can interact with the world.
You're missing the social interaction with other kids. And definitely through the pandemic, I would say that my son struggled a little bit more than my daughter in the sense that he missed his buddies and maybe became a bit more of a little bit of a hermit, which, is hard, right? So I think as parents, we just need to, we need to be cognizant of, the fact that our kids don't always verbalize the challenges that they're going through, both physically and I think mentally at this stage. So, interact with your kids, give them lots of time, give them lots of hugs, give them the snuggles, make sure this is an important time in most of our kids' ages where they're just developing and growing so much.
And knowing your kid is super important, right? And knowing what they need and knowing how stressed they are by it and knowing what you need to do to support them.
Therapists say taking care of your kid is important, but parents must also remember to take care of themselves.
This is a tough time for everyone, right? Not just for kids, for adults, for everyone. And kids need extra care and kindness right now, and parents do too. So if you are the parent of a young child or an older child, remember to be gentle, not only with your child, but with yourself.
Therapists suggest having conversations, asking about the day, and really listening to what your kid has to say. They say simply listening can make a world of difference for your child. In Winnipeg, Breanna Marcelo, City News.